Gordon Hayward versus Steph Curry versus Damian Lee. Hand injuries in the NBA. Let's get to it. Hey everybody, Dr. Chris, orthopedic surgeon and sports medicine physician. Welcome to my channel, your favorite source for information on broken bones and other stuff.
That's a little doctor joke we like to make around here.
So today we're talking about hand injuries in the NBA. Seems there's been a string of these injuries recently, so I thought it would be a great idea to talk about them all together in one video and to compare and contrast what is the same or what is different between the individual cases.
Okay.
So currently in the NBA, there are 3 big name players who have suffered hand injuries, all within the last 30 days. Those players include Steph Curry, Gordon Hayward, and most recently this past week, Damian Lee. So let's quickly recap what happened, when it happened, and how did it happen to each of these players. Steph Curry of the Golden State Warriors was injured on October 30th when they were playing against the Phoenix Suns. Steph Curry attempted to drive to the hoop between 2 defenders and he fell to the ground, injuring himself. More specifically, he fell to the ground head first, landing on his left hand with what is called a FOOSH mechanism, fall on outstretched hand. Subsequently, a Phoenix Suns player, Aaron Bynes, then landed on his left hand while it was on the ground. Steph was unable to continue play and he left the game early. Subsequent imaging with X-ray and then CT scan showed a fracture of his second metacarpal of the left hand. 2 days after his injury, Steph had surgery where a closed reduction and percutaneous pinning was performed. Steph Curry is expected to be out for approximately 3 months' time, and he is scheduled for a second surgery in the month of December, which will be approximately 6 weeks or so after the first surgery, in which he is going to have the pins that were percutaneously inserted into his hand removed. Gordon Hayward was injured on November 9th in a game versus the San Antonio Spurs. Unlike Steph Curry, Gordon was not injured from a fall or from somebody landing on his hand. Instead, Gordon was injured when he jammed his left hand against an opponent. During gameplay, while defending an opposing player, Hayward attempted to shadow that player while he made a drive to the hoop. Unfortunately, LaMarcus Aldridge had set an illegal block behind him, and as Hayward moved to his left, with his outstretched hand, he managed to run into Aldridge where he injured his hand. Hayward was unable to continue play and he left the game early. Subsequent X-ray imaging of his hand showed that he had suffered a displaced fracture of the 4th metacarpal of his left hand. Fortunately for Hayward, this was his non-shooting hand. 2 days after his injury, Gordon Hayward had surgery where an open reduction and internal fixation with a plate and subsequent pin was performed. Hayward is expected to be out for a period of approximately 6 weeks while the fracture heals, and then for an additional period of time afterwards as he goes through his rehabilitation in anticipation of his return to playing competitive basketball. And finally, Damian Lee of the Golden State Warriors. He is the player most recently injured on November 13 when the Golden State Warriors were playing the Utah Jazz. Although I can find no information about the exact mechanism of injury, Damian did injure his hand at some point during this game. Subsequent MRI imaging showed an undisplaced fracture of the 4th metacarpal of his right hand. Unfortunately for Damian, that's his shooting hand. As this fracture was not displaced, Damian did not undergo surgery. He has been treated with immobilization only, and he will be reassessed in 2 weeks' time to see how his fracture has healed. Although his fracture is not expected to fully heal in that time frame, that reassessment will determine whether they can continue to treat non-operatively with immobilization only, or whether they need to switch gears and change to an open reduction and internal fixation in order to have the fracture heal in a timely fashion. In total, Damian Lee is expected to be out approximately 6 to 8 weeks. So now that I brought you up to speed on these injuries, we have a few questions that we need to answer. Question number 1, what part of the hand was injured in each case? So as I said in the introduction, Steph Curry injured the second metacarpal, while both Damian Lee and Gordon Hayward injured the fourth metacarpal. Although these athletes did not all injure the same hand, all of these athletes did injure the same part of the hand, which is the metacarpal. And the metacarpal is basically the main bone of the hand. And this is the part of the hand that spans the distance between the carpus, or the 8 bones of the wrist, and the phalanges, or the small bones of the fingers. And as you might expect, for most people who have 5 fingers, you will have 5 metacarpals as well, 1 for each of the fingers. Metacarpal fractures are relatively common injuries, and they can occur when someone falls on their hand, or when they punch something, or when they're struck in the hand with something hard. Which leads us to question number 2. How did each of these metacarpal fractures occur? So let's talk about Steph Curry first. So if we look at the video of his injury and we slow it down, we can see that when he first fell to the ground, he fell with an outstretched hand. This type of impact would cause the metacarpal to undergo a bending moment or a tension force as the metacarpal was sandwiched in between the floor and the rest of Steph's body as he fell to the ground. However, to be honest, I don't think this is exactly when he suffered the fracture. Because if we let the film roll more, we can see that after falling to the ground, while he had all of this pressure on his hand, Aron Baynes then fell onto his hand, causing his hand to roll across the floor. In my opinion, this is the moment where he suffered the fracture. As Steph's hand was pinned underneath Baynes and then subsequently forced to rotate as Baynes rolled across the hand, it is conceivable that the second metacarpal was exposed to a rotational force. I've said this a million times in other videos. The bones are great in compression, but they suck in rotation. And this situation is no different. If the metacarpal was exposed to a rotational movement, eventually the bone is going to give up, cry uncle, and we are going to have a fracture. And I think that's what happened here with Steph Curry. I think that he suffered a spiral oblique fracture of the second metacarpal as a result of a rotatory force that was applied as Baynes rolled across his hand. Conversely, Gordon Hayward injured his hand in a collision with another player. If we look at the slow-mo film, we can see that Hayward had his fingers outstretched, and as he moved to his left, he collided with the opposing player. His finger got bent at an awkward angle, and he subsequently suffered the fracture of his fourth metacarpal. Although it is possible that Hayward's hand was injured strictly from the collision, I would suspect there might also be a rotational component involved here as well, since the finger was trapped and his hand was held at an awkward angle. And then of course there's Damian Lee, but we don't have any information on Damian Lee, so I can't really tell you how he injured his hand, just that it was injured. However, as the fracture was an undisplaced fracture of the fourth metacarpal, I would say that more than likely the fracture mechanism was not too onerous. So moving on, question number 3. How were these fractures imaged and diagnosed? The media reports stated that Hayward's fractures were imaged with X-rays. And generally speaking, X-rays are the first line of diagnostic imaging when we are assessing musculoskeletal injuries. We are able to determine the location and the type of fracture pattern using this imaging modality. However, sometimes fractures can be subtle and they may not be readily imaged or readily seen on simple X-rays alone. In these cases, we need to use another imaging modality. In addition, fractures can extend from the bone itself to the joint of which that bone is a part. In these particular cases, because these fractures involve the joint and we always want to make sure that we restore joints to their anatomic appearance, we may need to enlist other imaging modalities to get a more accurate picture of what is going on. And finally, if the fracture fragments are really small, like I'm talking really small, sometimes X-ray is not enough. Sometimes we need something else. We need the big guns. In those cases, we will typically employ a CT scan or computed tomography scan of that bone or the joint to see what's going on. So what the hell is a computed tomography? A CT scan. Basically, if you take a bunch of x-rays really, really fast at 1 millimeter increments apart from each other, you can move through a joint and get better resolution of what is going on in that joint or in that bone. While an x-ray might give you 2 views of a bone or a joint to assess a fracture, a CT scan or a computed tomography scan might give you hundreds of views of the bone or the joint to see what's going on. So clearly, the resolution of a CT scan is much better than that of an x-ray. In Steph Curry's case, they required a CT scan to better assess what was going on with his fracture. And this leads me to believe that his fracture extended from the metacarpal itself up distally or further into the metacarpal phalangeal joint, the MCP joint. And this was required in order to make sure that the articular surface at the MCP joint was okay. And this just means that they needed the CT to make sure that the joint remained nice and smooth and functioning properly, rather than to have bone sticking up or at an angle so that the bone kind of went and ground together like sandpaper, because that's not a good thing. And finally, in some cases, you can image with both X-ray and CT scan and still not see anything. So what then? In those cases, we'll use an MRI, or magnetic resonance imaging. And this is a different type of imaging which does not use radiation, which allows us to better assess what's going on in the soft tissues and inside the bone. This is the type of imaging that was used for Damian Lee, and so this leads me to believe that his fracture pattern was very subtle. It could not be seen on either X-ray or CT scan, but he continued to have pain, and so in order to further clarify what was going on, they performed an MRI, and using the MRI, they were able to see the swelling or the inflammation that was at the site of the fracture, and it was in this manner that they were able to diagnose he had an undisplaced fracture of his 4th metacarpal. So, question number 4. Why the different manners of treatment? So Damian Curry had an undisplaced fracture and he was treated with immobilization only. Steph Curry had a displaced fracture and he was treated with closed reduction percutaneous pinning. Pinning that we put through the skin without making a big formal incision. And finally, Gordon Hayward had open reduction internal fixation with a plate and screws and an adjunct pin. Which means we basically made an incision, we put on a plate with some screws to attach it, and then there was still some stuff that was not quite right, but too small for fixation, so they put a pin in to hold that. So why the different approaches? If we have a fracture and it is undisplaced, meaning that both ends of the fracture are in the location where they're supposed to be and they have not shifted or translated or rotated away from one another, we can treat this fracture with cast or splint immobilization only, and we don't have to do anything for surgery. However, if there is some displacement, then usually that's not acceptable, and we have to do something about it. Our first option for treatment in this case is what is called a closed reduction and cast immobilization. So that just basically means we're going to give the patient some pain medication, we are going to pull, snap, crackle, pop, put the bones back in the position where they're supposed to be, and then we'll put a cast or a splint around the fracture to hold it in place until the fracture is healed, usually 6 to 8 weeks. If we have performed a closed reduction, but then the fracture fragments are too unstable, even in a cast, then we may perform a closed reduction and then put a pin through both of the bone fragments percutaneously, meaning we poke it through the skin, in order to keep the fragments in place. Sometimes we can do this successfully with 1 pin, sometimes we need to use 2 pins, cross pins, and sometimes we need to use multiple pins. But this is the next step in our treatment algorithm. In some cases, however, there are many fragments, too many fragments to put a whole bunch of pins through. Or even with pinning, there is still going to be some amount of displacement at the points where two fracture fragments meet, or at the joint level. In these cases where there is persistent displacement after closed reduction, or there is displacement at the articular surface, then we will perform an open reduction and internal fixation. And this just means that instead of poking through the skin with pins, we are actually going to cut the skin open, expose the bone in the operative field, and under direct visualization, meaning we're looking right at it, we're going to put a plate on the bones and secure the plate with a series of screws. This will allow us to ensure that the fracture has been restored to as anatomic a position as possible. And although we always want to make sure that our reductions are anatomic, meaning they are exactly like they were before the fracture, sometimes because of a loss of bone or comminution, meaning the bone is crumpled up into many, many pieces, sometimes we're just not able to do that. And so we have to accept close to anatomic rather than anatomic itself. If we have placed a plate on the bone in the operative field, and yet there are still some fragments which are loose and they are too small to be screwed to the plate or attached to the plate or captured by the plate, sometimes we may need to use pinning in addition to the plate and screw fixation. And finally, if we have a fracture that is not extra-articular, meaning outside or away from the joint, but is instead intra-articular, meaning extending into the joint, then typically these are fractures that we are going to treat with an open reduction and internal fixation, even if there are only a few fracture fragments. And that's because we want to visualize, see the actual articular surface to make sure that we have restored the configuration so that the joint will be and work as smooth as is possible in the future. So finally, question number 5. What can be expected in terms of recovery for each of these 3 players? Despite the fact that these players all had their injuries treated differently, the recovery is going to be generally the same for all 3. And that is, it will take approximately 6 to 8 weeks for the fractures to heal. During that time, they will be immobilized with either a cast or a splint. After the fractures have healed, and we have confirmed this with radiographic review, meaning we have done x-rays over time to watch and document the healing. Once the fracture has been confirmed to be healed by x-rays, then we will allow these players to come out of their splint or cast immobilization, and we will start their rehabilitation. Although they could technically go back to playing at that point in time, none of them will be able to do so because their wrists would be very stiff and they would have lost a significant amount of strength in their hand and forearm as a result of the prolonged immobilization of their hand and wrist. So they're all going to have to undergo extensive rehabilitation to restore range of motion of the fingers, hand, and wrist, and to restore strength of the hand, fingers, and forearm. Usually this is going to take another 6 to 8 weeks after they've come out of the cast or splint. So in total, we're looking at about 12 to 16 weeks before they're able to return to play. And we can see this as Steph Curry subsequently said in a news conference after his surgery that he wasn't expecting to return for at least 3 months and that he was hoping to be able to play sometime in the spring. So there you have it. That's my take on Gordon Hayward versus Steph Curry versus Damon Lee. Hand injuries in the NBA. I hope this video has been both entertaining and educational for you. If I forgot something, be sure to let me know in the comment section down below. Be sure to like, share, and subscribe. And as always, that's been a word from Dr. Chris, not your everyday.
Just a flesh wound.